And what age, when you were talking about, young girls starting and they might have microcomedones, what age can or should they start treating their skin if they're to prevent the process?
Okay, so if there's a family tendency of acne, then I recommend that you might even start treating at the age of 8. I'll tell you a quick story. There was a physician who was very famous. His name was Dr. James Fulton.
Yes, I loved him. Did a lot of training with him.
Well, Dr. Fulton worked with Dr. Kligman at one time.
Right.
And he always liked to say that he was sort of the co-inventor of retinoic acid or retinol.
Right.
But he was Mr. Acne. At one time, he had clinics throughout the United
Yep.
States. Now, Dr. Fulton, before he became a doctor, was actually a chemist,
Mm-hmm.
a biochemist. And he had really severe acne, horrible
Yes.
acne. In fact, I can't remember how many years he's been dead now, but when I would see him at medical conferences, he was always still, even though he'd had a lot of acne surgery, he was clear, but he still had scarring.
Right.
And so so he had really severe acne, and he was concerned that because of that, his 2 children, boy and a girl, would have a genetic tendency to acne. So he started them using what we're going to talk about in a minute, the solution. He started them using that at the age of 8.
Right. Wow.
I'll tell you, his kids, I knew them throughout their teenage years, I never saw them with an acne lesion.
Wow. Yeah, he was an amazing man. Learned a lot from him. Well, that's good. So so they can use it as a preventing the process. So it's going to be not a concern